Okay.
Welcome, everyone. We're going to get started in just a second here. If you clicked into the Douglas County Behavioral Health Prevention Summit, you are in the right spot. We are going to hear lots of great information for the next hour. Make sure you have your lunch drink, and get snuggled in because we've got great information coming your way in just a second. We'll let everybody get into the room and get their audio connected, and then I will introduce our speaker in just a moment. Welcome, welcome. So as we've got some more participants coming in, welcome everyone to the 2021 Douglas County Behavioral Health Prevention Summit. That's a mouthful today. My name is Crystal Dalmasso and I'm with DECA. I'm one of your moderators. Deanne Armstrong is also on. So if you have any technical issues, go ahead and seek us out in the chat and we would be more than happy to help you out. I'm going to introduce the speaker in just a second, but before I do, just a couple of housekeeping notes as we get some more participants filtering in and getting their audio set up. We welcome you today. We're going to get a wealth of knowledge here for the next hour as Scott comes and brings us some information. But as we're listening, we ask that you keep yourself muted today unless Scott asks us to unmute. So keep those microphones muted. You can open up your video if you like, but make sure you keep your mic muted. We are being recorded this afternoon. So if you want to send this out to all of your friends afterwards, this video will be available after October 22nd. It'll be sent out. We do want you to participate with us. So make sure you're participating in the chat. If you have questions, let us know in the chat and we will make sure to answer questions. So utilize the chat and get your questions answered in the chat. Also watch the chat for CEU information. It will be coming out in the chat. So keep an eye on that as well. Thank you for hanging out with us on your lunch hour. And I'm excited to share with you that we have a fantastic speaker today, Mr. Scott Gagnon. He's going to bring us the layers of cannabis policy and where prevention fits in. And he will actually introduce a little bit more about himself. So thanks for hanging with us today. And Scott, I'll let you take it from here.
All right, thank you. Thanks for having me this morning. So yeah, my name is Scott Gagnon. I'm the Associate Executive Director for EdCare Educational Institute based here in Augusta, Maine. So I'm coming to you live from Maine, and also Director of our New England Prevention Technology Transfer Center, one of 10 centers across the country, and probably familiar with your own here in the Mid-America, PTDC. If you're not familiar with them, definitely check them out after today. But happy to be with you today. I almost said this morning, it's this afternoon, to talk about cannabis policy and prevention, which is a big topic these days across the country. So just a little roadmap of what we're going to cover. We're going to talk about the importance of cannabis policy literacy. So knowing where to find cannabis policy and how to understand it, and also discussion of the stages of cannabis legalization laws and the multiple layers of cannabis policy, and discuss the intersection of policy and prevention. So that's really the thread throughout this talk, is the importance of understanding policy from the very beginnings when something is proposed to the very end if something is voted on and implemented, and how we weave that into what we do in the work of prevention. Just a little terminology disclaimer. What often folks will talk about in terms of recreational cannabis, I'll say adult use cannabis instead of recreational. I'm not, just my own individual preference, not a big fan of the recreational term. Thing is, it's kind of normalizing used in that way. So yeah, I just want to give you a little bit about my background. Always this big long bio, but I just want you to understand kind of where I'm coming from on this topic, which is I'm a certified prevention specialist. So I've been in the prevention field for over 15 or so years, most of it all right here in Maine. I also have my master's degree in public policy, which I got from the Muskie School here in Maine. So when it comes to cannabis prevention, I come to it from really both of those angles, from a kind of public policy lens and then a prevention lens. And then here in Maine, I'm involved in different aspects of cannabis policy and prevention. On our state's Marijuana Advisory Commission, which was formed when our state legalized in 2016. As I mentioned, I'm the director of our New England PTTC, and our specialty training area is cannabis prevention, but I've also been involved in as a private citizen in some more political advocacy type roles, again, particularly when the legalization vote was here in Maine. There you can see a couple of photos of me in action there. So to set the stage, this is what kind of adult use cannabis policy looks like across the country. You can see it's quite a mix. So the dark green states are states that have some form of they have adult use and medical use. So they have adult legalized and they have medical cannabis also legalized. The sort of lime green states, I'm going to say, like North Dakota, Utah, Oklahoma, they have a medical program, but not a comprehensive medical program, but not an adult use program. The lighter green states, like Georgia, South Carolina, Texas, so that's a CBD low THC program. So it's like a medical program, but it's more really low potency products and very limited applications for it. And then the gray white states at this point don't have really a comprehensive policy in either way. So so that's kind of the lay of the land in the country. So, note, of course, that Kansas right now is not, one of the legalized states, both in terms of a comprehensive medical program or an adult use program, but I think it's never too early to really kind of avail yourself of understanding cannabis policy. And, in the spirit of maybe thinking ahead, if, I don't know what the conversations look like in Kansas right now in terms of legalization, but I think the more prepared we are for when these things come to us, the better off we'll be. So that's kind of the spirit of this presentation. So cannabis policy, and really any kind of forms of policy that intersects with our work, it's really important for us to have some kind of knowledge, a basic knowledge of how to find those policies and how they affect our work. So it's not just cannabis, it can be alcohol policy, tobacco policy. It's all very important information for us to have. And when I think of what are some of those fundamental skills that are important for us in the prevention field, these are just kind of, I think, some of the basic level things we want to be able to do or to understand. So one of those is just how are laws and rules written and passed in my state? What does that process look like from when it starts to when it ends? And then whether or not, and I don't know what this is the case in Kansas, but like in my state of Maine and other states, there's also a citizens process where citizens can vote on legislation. So if that's a process in Kansas, you'd want to be familiar with that. Where do I find my state's cannabis laws, rules, and regulations? So if you do have some form of legalization that passes, where can you find that? What committees handle cannabis legislation? In state legislatures, specific committees handle specific type genres, if you will, of policies. So, what committee in my legislature handles that? When you have legalized cannabis, who oversees the regulation of that? How do you connect with them? Where would you find local laws and ordinances that apply to legalization? And then more specific, again, to our work is how do I identify provisions that impact risk and protective factors? And how does my knowledge of cannabis policy inform my use of the strategic prevention framework and other prevention practices? So, like, as I mentioned, an important piece of this is understanding the policy process. And the way legalization unfolds pretty much in almost any state that has legalized, it's really followed this pretty similar pattern, which is these three stages. The first stage is sort of that campaign initiative stage, which is basically when a group comes forward either with a bill or a citizens initiative, if you have it, to legalize cannabis. In your case, I would assume if something came forward, it'd probably be in the medical realm, because that tends to be the way it goes, is the state starts with a medical legalization law and then it moves to adult use. So for example, here in Maine, we legalized medical, actually in 1999. It was just possession though, and then the stores and the dispensaries were, the medical dispensaries were legalized in 2009, and then our adult use was 2016. So before each of those, there was a campaign stage where the group that was putting the initiative forward, they kind of unveil it. There's press events, there's advertising campaigns, all this normal stuff that goes along with a political campaign. The next stage, if the initiative passes, would be the implementation. And then after that, it's the post-implementation changes, which is basically after the law passes each legislative session following that, there may be bills that are introduced to make further modifications or changes to that. And so this path really does apply both to on the medical side and the adult use side. And really, you can look at pretty much any state, it really follows this very predictable pattern. Sometimes the timeline is longer or shorter depending on the state, but it's a very similar pattern. So I mentioned the first stage is the campaign stage. And I think why it's important for us in prevention to be aware of this stage is because during the campaign stage, there's a lot of messaging that happens, because that's really the goal of the campaign, right? Is even if it's in the state legislature, they want to, the proponents are going to want to win over voters, because voters then call their state legislators to encourage them to vote a certain way on the initiative. So you can think of the campaign as a commercial, basically. So while you may not have adult use cannabis in your state, if an initiative, so you won't have commercials from cannabis companies necessarily. But if there's an initiative that comes forward, you can expect commercials for that campaign. And in a roundabout way, you do, to some degree, you do have to kind of sell cannabis to get voters to want to adopt it. So I think it's one way, because in prevention, we look at things such as advertising when it comes to alcohol and tobacco and the impact that that has on young people, perception of risk, those kind of things. But I think we can look at political campaigns the same, excuse me, the same way. Excuse me. So when it comes to the campaigns, there's some pretty common narratives that will emerge. Those tend to be around the revenues that can come in, legalization as a job creator, and then issues around criminal justice and social justice. So those are common themes that you tend to hear in the campaign stage. Some of the themes that are maybe less out there that I think are common upon us in the public health and prevention world are the issues that could come along with the commercial cannabis market, which would be increased retail access and impacts on things like addiction, impact on health, impact on communities and children, social costs, impairment, and then impact of commercialized cannabis on social justice, along with other things. So, I mean, it tends to be, again, there'll be a lot of media coverage around, again, things like revenues and those kind of things, but it's a little more muted with these more public health issues. And so again, that's where we can come in to kind of put those on the radar. The other things that can come with campaigns is different types of imagery. This is an example from a campaign in Ohio from 2015. We had this mascot Buddy who was going around during a voter registration drive. In Maine, we had an event around 420, April 20th, where a gentleman was giving away small samples of cannabis to folks in line. There's, of course, advertising that comes along with the industry. This is from a company that makes cannabis edibles. And sometimes these ads can follow similar patterns that we've seen in the past with tobacco companies and other, for-profit drug industries, where you're using young-looking people and superposing your slogan and product. But then there's just the look and feel of the industry itself as well, and that's an important thing for us to understand, is that the cannabis industry is not framing itself the way it was framed back in the 60s and the 70s. It's not lots of tie-dye and cannabis leaves and, you know, the kind of cliches from the head shops back in the day. It's really more and more, it's really more rebranding as a slick kind of retail experience. These are all real photos from different dispensaries. And when you look at these, you take away, like, I mean, it looks like it could be an Apple shop or a Panera Bread or something like really slick that you would find in a mall. So these things, so while you will see some of the more cliched kind of branding that comes along with them, more and more it is really, like I said, something that would really blend in any kind of mall across the country. Second stage is the implementation stage. So if if an initiative came to Kansas and it were to pass, the next thing that would happen is it would go to the legislature or stay in the legislature if it passed there, to create the implementation law. So that's the legislation that basically sets the path for what the regulation of cannabis will look like in that state, whether we're talking about a medical program or an adult use program. The next stage after that would be the rulemaking stage. And one way to think about this is your implementation legislation is kind of like the executive summary. It's like the outline of what regulation would look like, or the rules are more the finer nitty-gritty details, like the minutia of the different types of licenses, like when they can open, how many dispensaries there can be, really fine stipulations in terms of advertising and those kind of things. So it's really the finer details of what, and the minutia of what that would look like. So that's one way to think about it. Is the first step is that the big sort of executive summary of what it's going to look like, and the rules are really sort of the meat and potatoes of how regulation will operate. The other thing to know with the implementation stage is that typically there's hearings involved at both of these stages. So with implementation legislation, since it's legislation, normally there's opportunities for public hearings and public comment when it comes to state legislation. So that's one opportunity for input. The second opportunity would be rulemaking. So whatever body is responsible for rulemaking, when they have a draft set of rules, those would be released. And then at a minimum, there would be an opportunity for written comment, likely some kind of form of public comment. In this day and age, with COVID, a lot of states are opting to virtual hearings. So it may be a Zoom meeting or some similar platform. We log in and can, sign up for a time slot to do your testimony. So certainly that's another thing I would encourage is become familiar with how that works in your state in terms of hearings and providing comment on legislation and rules. But both of these would be prime opportunities for the public health voice to be heard, whether it's concerns that you see in legislation, potential legislation, or good things. I mean, that's the thing with hearings is it's always obvious that we want to come and point out all the bad things that we see in legislation and rules, which is very important, obviously, but also an opportunity to encourage good things that we may see. So if there was a implementation legislation for cannabis and we saw some good, strong public health provisions in there, we'd want to champion those because we want to make sure they stay in there. Because that's the trick with these hearings and the feedback is that oftentimes if state lawmakers don't hear a lot of feedback one way or another, they interpret that as nobody's worried about it. So public health and prevention doesn't really show up to talk about some of the challenges that may be in the law. The interpretation would be, well, we don't have to worry about this because no one came and said anything. So it's an important opportunity for engagement for sure, for the good and the bad. A couple of kind of pro tips I want to throw out there when it comes to legislation and rules. The first one is around legislation. And this, again, is not particular to cannabis law. It can be any types of law, even stuff that doesn't have anything to do with addiction or substances. And this first pro tip is around the issue of loopholes. So when it comes to legislation, really at any level, federal, state, or local, loopholes emerge when there's something that just isn't addressed in language in a particular law. Because usually what laws spell out are things that you're allowed to do and things that you're not allowed to do. But sometimes there's this gray area where there's language that doesn't really say one way or the other, whether or not you're allowed to do something. And so specifically to cannabis, the example I want to provide is a common loophole that emerges in state legalization laws, which is a gifting loophole. And I actually have a very specific example, like this news story came out just recently. This is from New York State that legalized last fall, 2020. So basically the way the gifting loophole works is in a lot of states, or actually pretty much every state that has adult use legal cannabis, there'll be a gifting provision in there. And what that provision allows you to do is, if you're adult 21 or over, you can gift cannabis that you've legally, acquired to another adult 21 or over in your state. Often this is to cover the fact that a lot of states will allow individuals to grow cannabis at home. And so if you're growing and you have an over 21 friend or family member who isn't, you can gift, part of what you're growing to them. So it's meant to really cover those kind of things. What it wasn't intended to cover were businesses. And so that's the loophole that emerged in a lot of states, where the language is kind of loose, where, it says that the cannabis has to be free. You can't charge anything for the cannabis, but it doesn't necessarily say you can't charge for something else that may come along with it. So this specific example from New York is this company, and I've already forgotten the name of what they were called, but it's a sticker shop, right? So they're selling stickers, and when you purchase a sticker, you get a gift of cannabis along with it for free. As you might imagine, some of the stickers are, a few bucks, and so you get a tiny amount of cannabis that comes along with it. Some of the stickers are over $200. The stickers aren't any bigger, but the bag of cannabis that comes along with it is. So as you can imagine, that this, obviously the intent of this is to get compensated for the cannabis, but the way the law is worded, there's this loophole that it's not expressed. What this company is doing is not expressly illegal in the law, because there's no language that says you can't do that. There's no language that says you can do it. So it's this loophole. And so a lot of states have dealt with this. Maine had it. Maine actually tightened it up and put additional, through subsequent legislation, added language that said you couldn't be compensated for anything, nothing that comes along with it, no service that comes along with it. Because that was the other way that companies were doing this, is they were charging a fee for the packaging, or charging a fee for delivery or handling or something like that. So some states will close it up in legislation. Others have been less successful. So again, that's an example of a loophole. So it's basically this kind of gray area, no man's land, where there's no language that really applies to the issue at hand, and which can lead to a lot of confusion, especially at a local level. Because when you think of a company like this that's operating in a municipality, there's no local license to do this. So the municipality has limited options as far as what they can do at a local level. The state is limited with what they can do, because again, the language just isn't there in the law to back them up. So it just creates a lot of challenging situations for everybody involved. My second pro tip is around potential conflicts or disconnects between the implementation law and the rules. So the example I have on this slide, so sometimes in the implementation law, again, I mentioned we may see things that are, from a public health perspective, are really good ideas that we want to encourage. But then when we get to the rulemaking phase, maybe it's not exactly the way we would have imagined it. So the specific example, again, I'll talk about from here in Maine is, and actually a lot of states have this, where under their adult use law, there's requirements for health and safety warnings on all cannabis products, on all the labels and the packaging. So we have that here in Maine, which, when we in the public health community saw that, it was like, oh, this is great. We're going to have health and safety warnings about addiction and pregnancy on every single product. But then when we read the rules, we kind of sunk, like, oh, I don't know, this is going to be good. And so I actually have an Easter egg on the slide. It's underneath the colored bars. There's a small line of text under there. It says, can you read this? Maine legalization implementation requires health warnings, but the minimum font is 6 points. Is this effective? And so that phrase is in 6-point font. So just imagine a line of text of that size, like underneath a logo or some other picture with your health and safety warning. And then think to yourself, how many people are even going to see that line of text, let alone be able to read it? And so that's sort of the watch out. And that's just one example where, and then why it's important to be paying attention to both levels, both the implementation legislation and the rulemaking piece. Like, so we can't just stop. We see something good in the law. We can't just like, okay, this is going to be good. We got to look at the rules too, because that potential disconnect where the rules is going to make it ineffective. So yeah, we were kind of just, and unfortunately, we caught this when it was too late. I mean, there's always the opportunity. I mean, the body that's in charge of the rule making and regulations, they always have the opportunity to throw out new rules and change rules. So, you know, even if it, so hopefully we'll get the opportunity to change that in future rulemaking exercises. I'm not going to show you these, but I did, and you're going to get the slides after this. So I did, just for reference, in case you're curious to see some examples of what legislation and rules look like in some states. I've included links to Vermont's legalization law. They haven't done the rulemaking yet, so they just have a implementation law at this point. Here in Maine, links to our law, our adult use law, and our rules for adult use. And then Massachusetts for their adult use law and their adult use rules. One thing I'll just point out is the body that ends up in charge of regulation can look a lot different from state to state, but it tends to be one of two things. It's usually either given to a specific branch of state government, an executive branch. So in our case in Maine, it's underneath the Office of Marijuana Policy, which is in our Division of Administrative and Financial Services. Then in the case of Massachusetts and Vermont, they actually form a separate commission that people get appointed to, and then they do the rulemaking. So I mean, it's still essentially an extension of state government, but it's not quite as enmeshed as a department of state government. All right, so I want to talk a little bit next about a couple of examples of how state policies can impact some of the things that we would worry about or concern ourselves in public health and addiction prevention. So the first example is from Oregon. And one of the issues that Oregon ran into a couple years ago was this huge surplus of harvested cannabis that was just kind of sitting in warehouses and not going anywhere. And at one point, the surplus was so large that if you made it all into joints, you could have made 1 billion joints. Looking at it another way, there was not so much of this cannabis that was just kind of sitting around in warehouses that it could have supplied every adult in Oregon for 6.5 years with a daily dose of THC. And then you can see the trend even from 2016, even in 2017, they had a 2-year supply. But what the issue was is there was a disconnect in their state law between the cultivation of and harvesting of cannabis and what was actually going out the door in the dispensaries. So basically, they were harvesting faster than they were selling it. That's essentially what was happening. And so you can probably think of a couple reasons at least why that would be an issue. But feel free if you want to put in the chat or unmute yourself. What would be an issue that you would identify as that may come from having an overproduction of cannabis or a glut of cannabis, if you will? So you can unmute and shout it out or put in the chat. What do you think would be a couple issues? Price drop. Yeah. Any others? Increased marketing. Yep. Oh, so you actually got the first one is on my next slide here. So the price is a big one. The marketing one is one too, because there's going to be increased pressure to get it out the door. So those actually would work hand in hand. So what they saw in Oregon was in 3 years, the price went from $10 a gram to less than $5 a gram. So a huge price drop. And then we can look at things like the alcohol research and tobacco research to know as we know, and as a field, that what the issues of price are when it comes to young underage use, but also, risky, unhealthy use amongst legal adults. But the marketing definitely is another one. I would say the other one too is diversion, potentially. Especially where we're in Kansas, and I think I saw there was at least one state around you that it is not yet legalized. So if you were surrounded by states that didn't have adult use legal cannabis, there could be some pressure for that to go out through the gray and black markets, which does tend to still happen. So it's a lot of issues there. So one of the solutions that states have put into policy is to make a stronger connection between what's being cultivated and what's being sold. So I pulled this language from Maine's law, but this is similar in other states as well. Most states, when they legalize adult use, so there's a license you apply for to be a cultivator of cannabis, and when you apply for that license, you apply to be a certain tier provider, which means basically how much square footage you have to grow. So in Maine, we have 4 tiers from 500 square feet up to 20,000 square feet. So in Maine, someone applies to be tier 2, 2,000 square feet. Business is really good for the first year or two. They want to move up to tier 3 and grow, get a bigger warehouse and whatnot. But in Maine law, before you do that, and part of that application, you're going to have to demonstrate that you're selling at least 85% of the product that you're cultivating. So there's got to be some kind of link between what you're selling or what you're growing and what's going out the door, which in Maine is done through, we have a tracking system that's required in here. It's called seed to sale tracking. We're literally from a seed to when it's a growing plant, a mature plant, when it's harvested, when it's put into a product. Every step along the way, there's this barcode system that's used to track to basically where it is and to make sure it's not getting diverted. So that's one example. Another example is from Colorado, which of course is one of the first states that legalized along with Washington. And one of the more recent, not recent, probably for a few years, they've been struggling with issues around particularly the concentrates. So if you're familiar with concentrates, these are the super potent forms of cannabis, 60% THC and upwards. These tend to be fairly popular in adult use cannabis markets. In fact, there's this sort of natural maturation process that happens in the markets that has been observed in sort of the economic research around cannabis markets, which is, initially the concentrate market is pretty small. It might start at like 10, 15% of all consumption, but then it rapidly starts to increase as the years go on in that state. So, Colorado now, a few years in, concentrates have become a very, very popular form of consumption in that state. But some of the public health issues they were dealing with was people over consuming, having really serious health complications and going to emergency rooms, emergency departments, hospitalizations, some acute mental health outcomes, some psychotic episodes. And so it was enough of an issue that there was bipartisan support to introduce this legislation, HB 1317, to try to rein it in a little bit. One of the immediate things they did was to limit the daily purchases of concentrates. So, in every state, when cannabis is legalized, there's a personal possession limit. It's the amount of cannabis you could have on your person at any one time. So in the case of Maine, it's 2.5 ounces. In Vermont, I think it's 1.5 ounce. But there's not necessarily a limit on like how many times you can go to a store in a day. So you can go to a store, get your personal possession amount, go home, then go back, so there's really no limits on that per se. And that's what they're trying to do here in Colorado, is limit the daily purchases, hoping that will help reduce some of these issues. There's also adding they're also making a change to their medical program where young people between the ages of 18 and 20, if they're looking to get a medical card, they need to get a second opinion from another medical professional instead of just going in with one. So trying to just create some more parameters and guide and sort of guardrails, if you will, around that to kind of rein that in a little bit. So next, I want to go into a couple other layers of policy. That was the name of this training, right? The layers of policy. And so we've talked a lot now about, the state level. Of course, there's three other layers. The federal layer, of course, above the state. And at the federal level, nothing has really changed too much. I mean, it's still, it's still Schedule 1. It's still federally prohibited substance. You do see bills from time to time coming to Congress around things like banking in particular. Different bills will come up. Sometimes it's around people who are in the VA system being able to access medical cannabis. So you see things like that. And there are bills that are introduced to legalize it federally, although because of the political makeup of Congress, it tends to not really get too far. There's probably, just my tea leaf reading is probably a few more years at the earliest before you see that happening at the federal level. So the federal status more or less hasn't really changed. But then when we get below the state level, when the state legalizes, two more layers we have to look at are the sort of the local level, municipal level, and an organizational policy. So at the local level, right? So a state legalizes, whether it's medical or adult use. Once that goes into law, then municipalities, hopefully they were already starting to have conversations to be prepared if it did go legal, to think about what do they do now at the local level around regulations. Now, of course, when a state legalizes, one of the things they legalize is possession. And so that's one thing that at the local level, there's really not much to be done at the local level. If it's, so in Maine, it's 2.5 ounces. It's 2.5 ounces everywhere in Maine. At the local level, you can't change or modify that at all. But there are some places where things can be modified and changed at the local level. So one of the first decisions that they have at the local level, if a state legalizes, is whether or not to opt in or opt out of the different license types that are created. So, so when a state legalizes, I mentioned, there's licenses that are for cultivation. Other types of licenses that will be in that market will be the licenses to operate the dispensaries, licenses to operate manufacturing. So that's where you're turning the cannabis plant material into products like edibles and concentrates. And then for testing. And so most states require testing for contaminants, THC levels. So there's often licenses for those. So then what happens in a lot of states is when they've legalized at the local level, the decision is what license types are we going to allow at the municipal level, if we're going to allow any at all, or are we going to allow all of them? And so the difference between opt-in and opt-out. An opt-out state basically means that in that state, after a state legalizes, at the local level, there has to be some kind of ordinance passed or a local vote, town council, selectmen, however your municipality organizes, to opt out of one or more license types. So a particular community in your state after legalized says, we don't want to have any dispensaries. We don't want any of the license types. So they have to have a local vote to opt out of that. Opt-in is the opposite, whereas by default, all the municipalities don't allow the license types and you have to opt into them. And actually Maine and Vermont are the two states that are opt-in states. Most every other state is opt-out. The argument I make for one versus the other is I think from a public health perspective, opt-in is the better of the two. And the reason for that is it provides municipalities more time to be deliberate and considerate about what the choices they're going to make. In a lot of these states where they're opt-out, I can't remember, it was New Jersey or Connecticut, they were given a window of I want to say 3 months or less to make the decision of whether or not they were going to allow or, which license types they were going to allow. And that's not a lot of time when you're a municipal government, you've got everything else on your plate. So I think opt-in provides a municipality more time and space to have deliberate, thoughtful conversations around that. So what we see often is there'll be a number of municipalities that, whether it's opt-out or opt-in, we will not have any of the license types. There'll be a number that will have all of them. And then there'll be a number that has some mix. So, again, most of my experience is here in Maine. So we have the city of Portland, Maine, that is basically going to have all of them. They're going to have all license types allowed. Some of the smaller communities and rural communities in Maine are really sticking to just like cultivation and maybe manufacturing, not dispensaries, because they just don't have the customer, they don't have the population base for it. Other more urban places, may prioritize more the dispensaries. So you tend to see a mix in terms of how the municipalities go forward with that. I mean, right now in Maine, 90% of our municipalities don't have anything. And then I'd say, then again, it's a mix of the different license types after that. So at the local level, let's say that they do decide they're going to opt in or not opt out of dispensaries or different license types. So then decisions have to be made around things like zoning. So municipality wants to have dispensaries available. Where are they going to go? Where are they going to be located? Where are they going to be allowed to operate and locate? Are there going to be any limits at the local level on how many there can be in our town or city? Are there going to be any density limits? So spacing requirements. So if you have multiple dispensaries, is there a minimum distance they have to be away from each other? What does local enforcement look like? Who's in charge of that? Is there funding for training to make sure the capacity is there? Buffer zones around schools. The buffer zones are done in a couple different ways. Sometimes the buffer zone will say 1,000 square feet. 1,000 feet from, as a crow flies, from between a dispensary and a school. Sometimes, like in Connecticut, the way they're doing it is 1,000 feet between any advertising in a school, which in a roundabout way is kind of the same thing, because most dispensaries are going to want to have some kind of signage on their dispensary, so it kind of gets at the same thing. So buffer zones is one. Smell and nuisance and other types of nuisance laws. Parcel limits. So if a state's going to allow home cultivation, are you going to put a limit on how many plants can be on any one piece of property? Local licensing fees. And then if there are local licensing fees, how is that revenue used? Can any of it go towards prevention, education, treatment, recovery, those kind of services? And then other additional local rules and guidelines. So as you can see, when a state legalizes, even when a state legalizes, the municipalities and the towns then have a lot on their plate in terms of decision making. And again, I think the role for prevention here is I think a big one is education, because our town governments or municipal governments, they have a lot of things they have to have on their plate. And like state lawmakers, they have to kind of be jacks of all trades and know a little bit about a lot. And often the experience, my experience has been the issues that tend to arise at the local level isn't necessarily out of any ill will or anything like that. Sometimes it's just not asking the right questions, not thinking about the right things, which again, I think is another plug for, if there is a choice, to go for opt-in versus opt-out, because you have more time to look into those things. One specific example I can give is in the city of Portland. They had this almost like a farmer's market for cannabis, except it's meant to be more like an informational fair in the middle of one of the big the city parks. So people could set up tables and advertise their business or their services. The city never thought to ask if any of these places were thinking about bringing products with them. They just never asked the question. And then shortly before, it dawned upon them, like, we should maybe ask about this. And then all the companies were like, yeah, we were going to bring samples and everything. And then they quickly had to scramble and cancel it, because they were not prepared to deal with that, because they wouldn't know how to regulate that and make it safe. So again, sometimes the issues just arise from not knowing the right questions to ask. And that's why we, through our education and our work, we can put those things kind of on the table for them to think about. And one tool that can be helpful, I think, for coalitions and the prevention field, especially when it comes working at the local level, are position statements. And basically, there's a wide variety of what these can look like. But really, this is an opportunity to kind of put all in one place sort of our primary concerns and hopes and wishes when it comes to how cannabis regulation is going to be handled. I mean, at the state level, we do that at the public hearings, and we do that, through public comment. But at a local level, same thing. We can show up at town councils and provide written comment. And then the position statement can really bring together all our key talking points. And so that's really what this tool is good for, is to create a common messaging theme, across all our partners and collaborators, some centralized data points, because there's a lot of data we can throw out when it comes to this, but you don't want to overwhelm people. You really want to kind of drill down to like 2 or 3 important points. So it's a good advocacy and education tool, and potentially is an opportunity to generate some media coverage through using the statement to create press releases and similar things. So some key components is, you want to have some kind of statement of the position. It doesn't necessarily have to be super specific. It can just be almost like a mission statement in terms of what are our sort of hopes and dreams or goals for our community when it comes to what cannabis regulation is going to look like. What is our rationale for that position based on the data and the science, and what are our recommendations? And so as I mentioned, you can use the tool to create press releases as a recruiting tool, maybe to get more folks in your coalition, folks who are concerned about this, and it's one way to get them on board to help with the messaging. And again, as a tool for centralizing. And I want to quickly show you a couple of examples that a couple of friends across the country have shared with me. So I did some work with a group here in Maine, in Gardner, Maine, just 20 miles from where I am right here. And at their town level, they had an ordinance coming forward. So basically what they were doing is that Gardner was looking at considering opting into having dispensaries in their town. And it seemed like it was pretty much a foregone conclusion that they were going to go forward, but there was an opportunity to provide input on things like density, outlet density, and zoning, and those kind of things. And so this coalition really wanted to pull together some talking points, some data, to ground themselves to approach that. So when they went to the town hall meetings and had the opportunity for a comment, they have a good strong base to put forward why there should be density limits, why there should be a limit on how many dispensaries there are, how they affect things like youth access, other substance use issues, and those kind of things. So you can see they had some sort of key statements, which they had cited with research, and then some action statements. So education, reducing the promotion, reducing retail availability, and issues around consequences. Another example is more of a statewide. This is from Georgia. I did some work with Georgia, and they had of course, in Georgia, they don't have adult use at this point, but it's something that's been coming up. So this is more of a precursor kind of advocacy. So again, this is more of a narrative form, but it's a similar thing where they kind of lay out sort of the scientific, the science for their position. So some of the outcomes that they've seen and some of the research, some of the issues around IQ and memory impacts and those kind of things. So again, in both of these cases, it was the tool was really to rally and kind of get everyone on the same page when it came to talking about these issues. And so when you get the slides, I included both of these documents as handouts that you can have for a reference. Let me get back to my slides. All right. So the last layer is the organizational layer. And when we think about the socio-ecological model, right, we know that the family layer has influence on young people. We know the broader societal, public policy, state, federal has impact, but our institutions, our organizations at the local level also can have impact. And some of those organizations and sectors include housing, education, K through 12, colleges and universities, employers, healthcare settings, public transportation. You can probably think of others. for sake of time, we won't go through this, but if you have examples of organizations and sectors you've worked with when it comes to policies, feel free to put those in the chat. But I think one of the great opportunities we have in the prevention space to support organizations and how they approach cannabis policy is really sharing with them some successful practices or important practices to include when they're doing either revision of policies or creating new policies that are going to be related to cannabis after the state legalizes. So those components are training, strong communication, good monitoring and evaluation, and having a strategy for periodic review and revision of policies. So to illustrate it with an example, a lot of states after they legalize, colleges and universities will adopt policies that primarily because of federal funding, that they're not going to allow cannabis possession on the campus anywhere, whether you're over 21 or under 21. And again, it's because of that federal funding and concerns about how that could be in jeopardy if they allowed possession on campus. So, and one of the reasons, so one of the things that Colorado, one of the first states ran into when they legalized is there was a lot of this sort of ad hoc messaging and promotion that if you're a college student over 21, you should look at going to Colorado because it's legal there. But the colleges were passing policies that said, well, no, you're not going to be able to possess on campus. But the incoming college students didn't know that. And so they're having all these possession issues. But that's because they didn't follow those 4 things. They didn't have good training to train their staff on the policy and the incoming students primarily on that policy and why it was there and how it was implemented. They didn't have a good communication strategy for the incoming students. They didn't have in place monitoring, evaluation, and periodic review and revision. So these are the things we can have in place at the beginning when if colleges make this decision to make sure that that policy is effective. So to develop a good training protocol, make sure you're identifying all the audiences that need the training, having a good communication plan, identifying those data measures in a process to know whether or not the policy is effective, and to have that period of review. All right, so going into our last section, just want to briefly talk about, so with our cannabis policy literacy, how do we weave that into our prevention process? I've already showed you one example in terms of how we can work with organizational partners, but more broadly, we can weave policy into how we use the strategic prevention framework. We can use it as important context when we're doing our needs assessments. We can use it to enhance the capacity of our coalition through training. It's important context when we select programs and strategies to know what the environment looks like. There's maybe provisions in policy that either help or hinder the implementation of our programming, so we'll want to know that. And it's an important context for when we evaluate the effectiveness of our programs. We can use it for the questions we come up with to ask during our needs assessment, whether they're the literal questions we're asking in surveys or the questions we're just asking ourselves when we think about the data that we're going to collect in our needs assessment. So are we seeing changes in consumption patterns? Are we seeing changes in adult use that may be affecting young people, particularly around parental use and parental monitoring? Are we seeing changes in policy that are being shaped by the pandemic? So similar to what we see with alcohol policies, things like to-go and deliveries. We can look at the policies to identify how it connects with our risk factors. So there's different provisions in cannabis policy that connect to the intervening variables and the risk factors that we address. So when it comes to perception of risk and harm, things like labeling and packaging, pricing and promotion, also advertising and cultivation, social access, whether or not there's social host laws. So you can see there's a lot of things in those provisions we'll want to know and be able to identify. Because then we can almost do a literal inventory when we're doing our needs assessment and our prevention planning. So when we've identified our priority risk areas that we're addressing in our community, how do those connect with what's in the cannabis policy? If I prioritize retail access, is there a particular provision in the cannabis law that is going to be a challenge or is problematic? And is there something we can do with our prevention programming to sort of counteract that or, to address that? But it's not just risk factors. There may be good things in the law that we want to enhance and lean into with our programming. So we also want to identify the ways that may tie into the protective factors that we're prioritizing. So it's just the strategic prevention framework, but it's also, we can weave the policy literacy into our strategy selection. So, we have our classic intervening variables that we just talked about. So perception of risk and harm, retail access, social access, pricing and promotion, policies, enforcement, and norms, right? So then when it comes to strategy selection, when we identify the intervening variable, then we want to drill down to those local conditions, right? What does this look like at the local level? So to illustrate that, if we've identified that retail access is our intervening variable, some of the things we may be seeing at the local level is things like dispensaries that are not carding on a consistent basis. A dispensary that may be very close to schools. It may be that we're learning that adults are buying and supplying to minors under the age of 21. Sorry, I want to make sure I leave time for questions. So then when we go to our strategy selection, so for the purposes of this talk, I'm using the CADCA 7 strategies. And hopefully you're familiar with those. If not, I did include a link here. So these are the 7 areas of different types of strategies we can employ at the local level. So I'd say again, for our example, we've prioritized retail access. The local condition we want to address is a dispensary that's not carding consistently. So the policy we want to modify as one of our strategies is a municipal policy that's going to require all staff of the dispensaries to be trained in some kind of responsible service training, similar to like a responsible service training for alcohol outlets. So then we can link the other 6 strategies to that policy. You may want to set the stage by providing information through a town hall, laying out the science and data of why this is important. We can enhance skills through developing the training and providing the training to the dispensaries. We can provide support by having an anonymous tip line to report when dispensaries are not carding. We can enhance access to technology and training for identifying fake IDs. We can change consequences through a disincentive, maybe a fine for dispensaries that are found not to be carding, or incentive through rewards, recognition for dispensaries that are carding 100%. Changing physical design, there may be something about the layout of dispensaries that's lending itself to not consistent carding. So I know I kind of went through that fairly quickly, but just again, an example of how having awareness of policy, using policy to inform our strategy selection process. All right, so I want to leave the last couple minutes for questions. The last section here is I do have some resources for further, like maybe a further help. There's some evidence-based practice guides from SAMHSA, one on 18 to 25-year-olds, one around pregnancy, and then a number of toolkits that you can use in your work there. And then also just highlighting that we have a 3-part cannabis pharmacology course that's coming from the entire PTDC network. I'm sure your PTDC will promote that when it comes out, so keep an eye out for that. But sorry, I took up almost the whole hour, but if you do have any questions, I can take those now.
Thanks, Scott, for coming, and that was fantastic information. And if there are any questions, please either unmute and feel free to shoot your questions out, or you can put them in the chat and we can always pass them along to Scott afterwards and get his reply, or he's here now, we can get his reply to your questions now. If you do have to hop off, it is 1 o'clock. So if you do have to hop off, feel free to hop off, but make sure you're with us for our last session on Thursday. We'll have one more session in the summit on Thursday. So come back at noon on Thursday and we will see you for our very last session. If you do have questions, feel free to put them in the chat or unmute yourself and Scott can answer those questions. But thank you, Scott, for coming today and being with us and bringing such important information.
Yeah, and feel free to email me as well. Email me there as well. So
yeah, and we'll be sure to get these slides and all of the resources that you sent out in a follow-up email.
Hi, Scott. I had a quick question for you.
sure.
I was wondering, with public policy, have you come across any revisions involving, regulations related to accidental child use in terms of like ER rates or calls to like toxic, I forget, like, phone calls where there's accidental ingestion. I'm just curious if you've come across any of that research or any things that you've seen.
Yeah, well, it's that we're experiencing that right now in Maine. I was actually interviewed by public radio here. We've had some increased calls to our poison center around the unintentional ingestions, mostly amongst very young children, but even some overdoses of adolescents and even adults. That was also, I would say, some of the background, what informed that law that they passed in Colorado too, was some of the, particularly with the concentrate. So, I mean, even some of the products that aren't concentrates, particularly with the edibles, they can still be fairly potent, just because there's a large demand for them. So yeah, that bill in Colorado, I mean, in Maine, nothing's come from it yet, but we're certainly advocating for it. And I would say in Vermont, in Connecticut, they actually have potency caps for THC of 30% for flower. So that's a plant material. So the plants can't be more than 30% THC. And then the concentrates have a cap of 60%. It's only on the adult use side. It's not on the medical side. But that was one of the reasons behind that, or as part of the advocacy behind that, was to try to limit like the super potent products in the stores.
Okay, thank you.
Sure.
Any other last minute questions?
I was going to say, we did have a comment, and I didn't know if you wanted to comment back about their OCD kids who are using marijuana are able to reduce their prescription.
Yeah, I mean, I know there's ongoing research in a lot of different ways around cannabis. I mean, unfortunately, we don't really have a lot of strong peer-reviewed studies in that area. At this point, we have some moderate evidence for things like pain, some symptoms with MS. There's appetite with HIV and AIDS. So I'd say otherwise, we don't really have a lot of strong evidence in that area, but I know that that's something the Biden administration has been working on, trying to loosen up sort of the red tape that gets in the way of research. They've expanded the number of federally funded farms that can grow cannabis for research. So hopefully there'll be more coming out from that. So we do want some good peer-reviewed science behind those kind of things.
Thank you for coming on. Thank you for joining us today. Any other questions? Thanks for sharing your email, Scott. And if any other questions come in, we'll definitely pass them along to you and let you respond.
Mm-hmm. Great. Yeah, well, thanks again for virtually having me in Kansas.
Yeah. Welcome to Kansas. Yeah.
Hope to see you there in person someday.
Thank you. All right. We'll end it for today. We'll see you all next coming up this Thursday.
Bye-bye.